Hey guys, I'm coming to you with Death by PowerPoint. So this is Ascension Pain Management. This is a new tool. It's called POS. It's something we're going to be moving to as of June 31st. Alright, hang tight. Okay, so why are we doing this? Or what's the what behind it? So there's pain management initiatives that require all ministries to utilize key practices and implementation tools for reducing and prescribing the use of opioids while improving pain management across the care continuum by the end of fiscal year 2020. Here is the why. Obviously, we have an opioid crisis. I'll just pause for a second. If you guys want to read, please feel free. Okay, so the background. So oversedation is a serious side effect of opioid administration. The POS assesses oversedation. It's also not used for intentional sedation, which we don't do. It is a lot like RAS that we already currently use. So here is some patient population that is included. So labor and delivery, maternity services is included in this. So this is what the sedation scale looks like. Like I said, it's something that looks very familiar to what we've used already. So I don't think we're going to have a huge issue adapting to this. Here are the interventions. So obviously, if you're frequently drowsy, you need to monitor respiratory status and sedation level closely until the sedation level is stable and less than a 3 at the respiratory status. Also decrease opioid dose by 25 to 50% and contact your provider. Also consider administering non-sedating opioid-sparing non-opioids like NSAIDs or Tylenol. And then ask the patient to continue to take deep breaths. Sorry, I'm wiggly. So this is if you're a 4, what to do. So you would stop opioids, consider Narcan, stay with the patient, stimulate and support respiration as needed, call a CRT or a Robert if needed. And here's what the documentation looks like. So, like I said, when it gets into COMPASS, ignore the EPIC portion because we don't do EPIC. But there's the COMPASS portion right there, and it looks very similar to what we've done in the past. So, assessment of the patient. So, sorry, I've got to adjust. So you're going to observe the patient without stimulation, touch the patient, can they be aroused, and always assess respiration status before arousing the patient. It's also recommended to assess sedation and respiratory status every 1 to 2 hours during the first 24 hours of opioid therapy, and then every 4 hours if they're stable. For the sleeping patient, assess respiratory status prior to waking. Arouse the patient if you're unsure if the patient is sleeping normally or over-sedated. The most dangerous time for the patient in terms of opioid-induced respiratory depression is during the first 24 hours of therapy. So here's the key points. Start with the lowest effective dose. Assess sedation using the POS scoring system. Intervene as needed. Observe and monitor for desaturation and apnea. Communicate sedation status during handoff communications, and sedation is a measure of level of consciousness and cannot be assessed while the patient is asleep. So here's some examples of sedatives. Okay, so we're beginning education now, which is 2 days post the go education time. And then also we'll go live, June 30th. So here's case studies. Sorry, I'm trying to get to ours. So here's our labor and delivery case study. We have a 37-year-old G1 that's in active labor. She received fentanyl 100 micrograms an hour and a half ago when you last assessed her. She's now rating her pain an 8 out of 10. She's asking for more medication. She has fentanyl, 100 mics IV PRN times 3 doses ordered. She's alert, anxious, and then she's not aggressive. So what's her POS score? I'll let you guys think about what it is. And then the second one is our postpartum patient, Miss Longoria. She delivered a healthy baby boy via C-section 6 hours ago, rating her pain a 7 out of 10, asking for pain meds. She has oxycodone ordered. Her last dose of ibuprofen was 4 hours ago. She's drowsy but responds to prompts and opens her eyes. What do you think her POS score is? So, with that being said, I think that's all of our case studies. This PowerPoint is on a REDCap tool. I'm emailing that out along with this video, so if you want to look at it further and kind of go through it, please feel free. Thanks.